Welcome to another Periscope with Dr. Vaughn, and we are at the Auburn Medical Group right now. As you can see behind me, medical instruments on the wall because that's where we are in the medical office in the exam room. And earlier today we were able to show some simple stuff that often comes across the primary care office of cerumen or earwax removal from a little girl's ears. A little traumatic for her, but she held up pretty well. Do we have any comments or questions out there? Or did anybody catch the WCG World, the blog post about physicians using Periscope? We were honored to be featured in that. I don't know if you guys saw that. That's on our Twitter. For those of you who don't already follow, you can follow my Twitter at Dr. Vaughn, or those of you who don't follow us here already, just swipe right to follow. And we'll go ahead and do a regular Ask the Doctor session for those of you who have just topics, medical topics you want to talk about, anything that comes up. We had some good updates yesterday. One of the updates was on the biopsy we had done earlier in the week, the skin rash that we found out that it was Schomburg's disease. It takes me a second to remember that one because this is the first case I've ever seen of Schomburg's disease. And then somebody was asking about the shave biopsy we had done either late last week or early this week, and it turned out to just be a benign mole, so that's all that it was. Do we have any comments coming up?
Nothing important.
Nothing important.
Someone asked if you play video games.
Not anymore. No. The last video games I played were when the early Jedi Knight series was coming out, and LucasArts had one called Outlaws, both first-person shooter style. That was about it for video games for me. None now. I just don't enjoy them like I used to. Yeah. Go ahead, whatever they're, right, let us know. If it's just nice complimentary things, if it's critiques, whatever, let me know what's being said.
What medications contribute to hair loss in men?
Contribute to hair loss, testosterone. Testosterone supplementation would be a risk factor for baldness. Anything else? No? Okay. Let me go ahead and grab the phone and turn it around so that kind of real time. Hey, Roby Doug, thank you for joining us. I'll go ahead and do a handheld here. I'm sorry that the lighting is so harsh on the... Boy, that probably blinds you guys. Let me see if I can actually clean the camera a little bit there. Creatine as a supplement, creatine does not seem to have the benefits that they promote it to have, as far as the muscle building. If it does, it's not that big of an improvement, and it's very important to take it with enough water if you are going to use it, and don't overuse it. You're not getting any benefit from overusing it, and it's actually a risk factor for kidney health to use too much creatine. Okay, I'm sorry I missed those comments there. Go ahead and put them back up. I was talking about the creatine. I don't tell people absolutely don't do creatine because there is some little bit of benefit. WOFAT, welcome. But you really do need to take enough water with it and don't overdo it. And it's good to get the timing right with exercise. When you're going to be doing the exercise, you want the creatine in place to make use of it for building the muscle. So you want to have it, actually I'm going to have to claim ignorance on that. You're going to have to read the directions on when the best timing is, but do get the timing right. Biotin help with hair replacement and strength of hair. It may help a little bit with strengthening hair and nails. And we do recommend it as something for people who are having problem with hair breaking easily or having problems with their nails not being strong. And we do get some improvement, nothing super dramatic. Something that needs to be checked is thyroid levels when people are having these problems, because it may be because they're not getting enough thyroid activity that they're having these problems. And thank you for the hearts, by the way. In fact, anybody watching, just go ahead and tap your screen as you're watching it, and that can provide hearts for us. And thank you, and it helps us to be able to come up higher on the results when people are looking for what's on Periscope so other people can join us. Can we see you operate on something? Absolutely. Go ahead and look back at the past Periscopes or on our YouTube channel at Auburn Medical Group. You can see us doing some operations. What specifically is thyroid activity? There's a hormone called thyroxine that comes from the thyroid gland, and it plays a role in regulation of metabolism and does have a role in how well the hair grows and the nails. Chest plate pain after activity. I guess you're referring to your chest wall hurting after you're physically active. One thing you'd be concerned about is that you're calling it the chest plate or chest wall when it's actually the heart. That would be very concerning. That should be checked out with a cardiac workup or heart workup. Also, you'd want to get checked by a doctor for some other problems, perhaps with the lungs right underneath the chest wall. Most likely, it's actually something benign, which would be just simply some muscle spasm inside of the muscles between the ribs, or on the other side of the ribs there's actually several layers of muscles in the chest wall, and lots of opportunity to have some tightness there. You can also have problems in the bones of the chest wall where the ribs and the sternum come together. There's something called costochondritis, or inflammation of the cartilage, that's quite often. Somebody's talking about their neck curving the wrong way. My chiropractor recommends neck pump. Is there anything else? Sorry, I'm not familiar with the neck pump. When you say curving the wrong way, I think you're talking about it instead of curving, forward in the middle, doing the opposite, so you're kind of hunching over. And I don't see it go quite like that. We do sometimes see a straightening of the normal curvature of the spine in people who have spasm of the muscles. You'll see it quite often after car accidents. People have this just absolutely straight spine, and it's because their muscles are all in contraction and they hold your neck stiff, and usually you're hurting when you have that. And welcome, Sarah Nicole. Due to a car accident, we often see the straightening of the spine after a car accident, loss of the normal curvature. What's that black doodad on the wall for? Black doodad on the wall. Well, let's go over that since you want to know what black doodads are. Let's see what we have here around and show you that we have some specula for putting on the otoscope for looking in ears and noses and other parts of the body. We do not, let's see, we used this earlier. In fact, you can still review the periscope from earlier that was showing the ear wax removal, although you can't really see a whole lot because you can't really get the periscope. Well, maybe we can get periscope to look through and see. Is this working here? You know what? Maybe we could have used the periscope. I'm trying to look at the switch there. It would have been very difficult to use periscope to actually look inside of the ear. And then we have a blood pressure cuff with a couple of different actual cuffs for measuring people's blood pressure. And then this doodad here is an ophthalmoscope. Actually, it's a pretty fancy ophthalmoscope as far as they go. This one is called the Panoptic. Allows you to get a great view in the back of someone's eye. I actually look through this portion here, and then we put this portion, or sorry, I can't point, put this portion here up to the patient's eye, and we're able to look in, and through their pupil, you can see the back of the eye, the retina, and you can look for various problems, including problems with the blood vessels. One of the things we do is look at people with high blood pressure and people with diabetes to see if they're having damage to the vessels from those. They are fancy and expensive. In fact, that's why we only have one Panoptic ophthalmoscope in the whole office. Somebody gets pain in their thumb below the joint when they press it a certain way. Yeah. Oftentimes people can have problems in this joint back here, or even all the way back at the wrist, further down there. The common places for people to get both arthritis and tendonitis. There's different tests that we do in the office to tell them apart. One of them's the Finkelstein's test, where we have a person put their thumb in their fist and then push down like this. And then if it hurts, that's a sign that often goes along with de Quervain's tenosynovitis. And that is the tendon that runs, kind of hard to show you here. The tendon that runs down straight from the thumb and on down the forearm, and usually treated with splinting, sometimes with cortisone shots. And then people often get arthritis there too, and that can get cortisone shots for their arthritis. Sometimes they'll actually have to have a surgical procedure done when they've had the arthritis for a very long time and it stops responding to the shots. Where does the digestion of carbohydrates start? Okay, that's our quiz. Danielle wanted a quiz. Where does the digestion of carbohydrates start? We'll just have the answers go in order of the digestive tract. Does it actually start in the mouth? Does it start in the esophagus? Does it start in the stomach? Or does it wait until it gets into the intestines? Again, where does the digestion of carbohydrates start? Mouth, esophagus, stomach, intestines. So you guys go ahead and put up your answers. And Danielle says stomach. If you guys think it's stomach, go ahead and put a lot of hearts up there if you think it's stomach. Danielle, you think it's stomach. Put up a bunch of hearts. Anybody for esophagus, mouth, or intestines for where digestion of carbohydrates? Oh, here come our answers. Okay, we got another stomach, we got a mouth, we got intestines, and we got a mouth. Okay, and lots of hearts. So the answer is mouth. Salivary amylase. It's an enzyme that's actually in your saliva and starts to break down simple sugars, those simple carbohydrates that we tell you to avoid. Things like, well, the starches, crackers and potatoes and chips. They actually start the breakdown process in the mouth before you even get them swallowed. And, you know, I guess if you spit on things, you could actually start the process kind of like the fly. I don't know how much you would actually get done, though. Okay. Somebody wants to know about constant tinnitus, and somebody wants to know if a child born with a chloroplast cell could be a child considered having a... I don't know of chloroplasts in animals. And hello. Welcome. I'm glad you enjoy our channel. If you don't already follow, make sure you swipe right and follow and share with your friends and give us lots of hearts. Holly Weiss, thank you for joining us. Any thoughts on alcohol consumption actually reducing PVC occurrence or magnitude in the heart? PVC being a premature ventricular contraction or a skipped beat is often what they feel like in the heart. It's where part of the heart beats a little bit early. I don't have knowledge of alcohol, like having a drink, making a difference in them occurring less often. It might make you less sensitive to it, so you don't know they're happening. The definition of palpitations is an unusual awareness of one's heartbeat, and it can happen in the setting of unusual heartbeats or completely normal heartbeats, just the unusual awareness of one's heartbeat, as we often see in anxiety states. Now, alcohol can affect heartbeats over the long term, cardiac conduction. It can actually cause alcohol cardiomyopathy and cause real problems. But in the short term, like a drink to help not feel the heartbeat, that sounds more like kind of like an anxiety treatment like you would do with Valium, although I don't anymore prescribe benzodiazepines or Valium medicines for anxiety symptoms. But it used to be done, and some doctors still do it because it takes away that awareness of one's unusual heartbeats as they occur. Sorry, while I was answering that, I missed some of the questions there. Thank you for all the hearts, though. I really like that. We can do another quiz. Which class of medicine is known to cause dependence and tolerance? Opiates, benzodiazepines, non-steroidal anti-inflammatory medicines, or beta blockers? Which of them cause tolerance and dependence? Meaning, tolerance is you get used to the effect and you need more. Dependence means that you get dependent on it and you have to have it. Okay, we got some answer for benzos, we got an answer for opiates, got an answer for benzos. You guys are all correct. Both benzodiazepines and opiates cause tolerance and dependence. The non-steroidal anti-inflammatory drugs don't. The beta blockers do not, although sometimes people ask me if it does. The opiates is actually the topic of our show tomorrow that we're going to have at medicallyspeakingradio.com, 10 o'clock Pacific time. We're going to have a show with a patient as our guest. My co-host Larry Finney will be there with me. He's the funny one. He's not a doctor, but he's funny. And we're going to speak to Dennis Bueller about his experience getting off of chronic opioid use. Somebody on Klonopin for a long time, I'm sorry. I hope you'll be able to get off of it. Just check blood pressure, 94/75. Hello from Ireland. Hello, Ireland. 9 years here. Thank you again for all you guys, all your hearts and all your participation here and all the people that are following. And we'll go ahead and question about my blood pressure. Well, we don't answer personal questions here. That's kind of for a true doctor-patient relationship. This is more a topic, but we can talk about the topic if you can kind of phrase it in a general question. And somebody asked if endometriosis can be dangerous to the lungs. Strange thing, endometriosis. It's the occurrence of the normal lining of the uterus or the endometrium in unusual places, and it can get in weird places. They used to think that it was spreading outside through the fallopian tubes, and they'd get out from the fimbriae and just spread through the peritoneum, because you often see it on other abdominal organs. But now it's thought that these little patches of endometrial tissue can grow completely separate, and that maybe they're spreading through another means, or kind of like cancer cells, one cell type turns into a different cell type. Maybe somehow hormonal influence or something else is turning on the genes in certain cells in the body to become endometrial cells. And so I would not say that it's impossible for somebody to have it occur in their lungs. Somebody's going to have a hysterectomy at only 23. I'm sorry. I'm afraid my blood pressure is too low. I'll tell you how to know your blood pressure is too low. It's not based just on the number. You know, there's people walking around, particularly young, fit